So you were diagnosed in college, but have
Yes.
suffered from symptoms all your life. So do you know why it took so many years for your illness to be identified?
Well, I understand how that happened in Guyana, South America, because they, sadly enough, it's a very ethnic, country. You would think that they would know about sickle cell disease, but the awareness just was not there. And then, to be honest with you, I think people don't access healthcare unless they were, severely ill. And so, because I would stay for a couple of weeks sick and then manage to bounce back, that's what my family did. They just kind of took care of me at home, and until I bounced back. It wasn't until I was 12 and not bouncing back and looked like I was dying that, they rushed me to the hospital. Over here, I think it's a little bit different, and I think the problem here is that we now test for sickle cell disease at birth, but there's not a timeline where we test anywhere else. So it's not like, when, kids are going to school, to high school or to college or some, some marker where you say, okay, let's test again, let's do another round, because that would take into account immigration, right? People coming in that may not have been tested. That would take into account people who were born before, there was a wide mandate to test in all 50 states. So I have friends that are diagnosed there's a friend I have that's diagnosed in her 60s. And she was right here. But because there's not, it's like everybody thinks of, diagnosis at birth and then nothing.
Yeah.
So it misses all the other opportunities to diagnose.
And then about that, then we have often heard from ethnic searching patients that they felt the doctors lacked empathy for their reported pain. Some patients have even shared that they felt doctors were unsympathetic because they thought they were only seeking drugs or medication. Unfortunately, throughout the years, have you ever felt that doctors treating you didn't fully understand your condition and or any of the pain you were experiencing?
Oh, of course. I think that's the case for probably every sickle cell patient that you'll talk to. That it's sad, but that's the reality. I think what it is that, the textbooks are old. If you blow on the pages, it'd probably fall apart when it comes to, any kind of update or history of sickle cell disease. And so, and then they tend to know of one type of sickle cell disease where there's, breakdown of red blood cells and it causes like massive anemia. So they're looking for that. And all the other types of sickle cell disease that don't present in that way, that actually have, vaso-occlusion because of maybe, viscosity, because it's too thick, they miss. So they'll look at me and they'll say, I've had a doctor look at me and say, well, your labs look normal, so therefore, he says, I don't understand why you're saying you're in pain. You look great, actually. Your labs look normal. And I go, that is the problem. My labs look normal, and they shouldn't. And at 11 with curved red blood cells,
right.
That's a problem. That's like a collision. And so they're too congested. They're sticking on each other. They're blocking things, but they don't know that picture. They only know the picture of broken down red blood cells. And so they'll say, well, your reticulocyte count is not, sufficiently elevated, and that's because they're looking at the wrong thing. And so I would say, even to doctors, treat the patient, not the textbook. Your textbook is already outdated. And so if the patient is in front of you saying, I'm in pain, you really think they'd say that so many times and it not be the case? So if you're seeing a patient in pain and your labs look normal, your conclusion should be, well, maybe it's possible for a crisis to happen even with normal labs, right? If you see enough patients presenting that way, you think that would be the conclusion. but in fact, they will stick to what they've read many years ago in an old textbook and not treat the patient. So that's why we get what we get.